Tips for parents to help an autistic child.
Hi, my name's Francesca.
And I'm Sarah.
We work at Great Ormond Street Hospital for Children in England.
Our team works with autistic children and young people every day, as well as their parents and carers, and a range of other healthcare professionals. Together, we work to understand their strengths and struggles. We also advise on support for the young person to live life to the full.
We've consulted with young autistic people and their families to develop our advice, and we're going to suggest tips to help an autistic child. Our first tip is to look after yourself as much as possible and seek support so you're not having to manage alone. It's much easier to meet your child's needs if you're in a good place yourself and have energy. Secondly, try to surround yourself with others who can be a positive support. These might be people who know about autism, or they might be people in your life who are kind, open-minded and willing to learn about your child. It can take some time for others, including family members and teachers, to learn about autism. Parents and carers can try to connect with others whose children have similar needs, who can give advice and support. These might be people in your local community or a child's school. There are also some great organisations that can provide information and help or point you to support groups or things in your local area.
Our third tip is to try to understand your child's behaviour. If you're finding a particular behaviour difficult to manage, try to think about your child's perspective and what they might be feeling. For example, they might be feeling confused or scared in the face of an unfamiliar event or situation, a change to their routine, or a task that is too challenging. The child might be feeling overwhelmed due to sensory sensitivities, or they may not understand what behaviour is expected, how to do this, and why it's important. Our final tip is to make positive changes to support communication and think about the environment to try to address why a child might be behaving in a certain way. Can you do things like reduce the amount of stimulation by bringing them into a less busy or more comfortable place? Can you give notice before there is change? Before you go to an unfamiliar place, could you take some time to talk through with the child what they can expect?
In the moment, it might be tempting to respond in more punitive ways, such as smacking or removing privileges. However, for some children, this can be a traumatic experience that may have long-lasting negative effects. It is also ineffective as it doesn't address the cause of the behaviour. You could instead support them to learn how to manage their feelings, for example, using a 5-point scale to help them identify and communicate what they are feeling. Or do a sensory activity that is relaxing for them, such as stroking a favourite toy or being hugged. You could further look to improve communication by allowing time for a child to process what you have said, using clear and literal phrases, and letting them know the order in which activities will happen. You can use a visual tool, such as a feelings thermometer, to help your child communicate how they feel.
In most cases, it's helpful to tell relevant people about your child's needs, such as school teachers. They may need to make reasonable adjustments to meet your child's learning and emotional needs. Research shows that autistic children often have mental health difficulties or other diagnoses that they may need support with too. These include anxiety, depression, attention deficit hyperactivity disorder, and obsessive compulsive disorder. Autistic children may also have an intellectual disability, sometimes called learning difficulties. If you're struggling, the first point of contact should be your GP, who can refer to your local child and adolescent mental health service, CAMS, or other mental health services. Autism is many things, but put simply, it's a different way of viewing and experiencing the world, which can be challenging. It can also bring strength and unique perspectives which benefit the world. Many autistic young people tell us it's a positive part of their identity, which they're proud of.